In a recent study, it was found that around 30% of the children in India in the age band of 5 to 9 years have high triglyceride levels. And we all know that one of the key reasons is high consumption of sugar and ultra-processed foods, which leads to high TG levels, as well as consumption of seed oils and deficiency of an essential fatty acid, which is pentadeconic acid C15, which can be easily found in foods such as butter, ghee, and full fat milk, right? So this saturated fat could actually make your red blood cell fragile, and your macrophages from the liver can actually engulf these red blood cells, and the what is left behind is corpses of iron, which leads to, or preferably leads to, liver dysfunction and inappropriate glucose response, and leads to high triglyceride levels. However, the biggest reason is compromised oral health. So when you have oral microbial dysbiosis because of improper nutrition or wrong oral hygiene practices, it could lead to inflammation in the mouth, and over a period of time could lead to leaky gums. This allows certain bacteria such as P. gingivalis to enter the bloodstream, and produces specific endotoxin called lipopolysaccharides, LPS. This LPS actually triggers liver to increase the synthesis and secretion of triglyceride-rich lipoproteins and inhibit a particular enzyme called LPL, which is required to break down the triglycerides from these lipoproteins. The end result is, there's a high circulatory level of, triglycerides in the bloodstream, high level of TRLs and low level of LPL, right? And this elevates the TG, specifically in the children, right? And again, and this is one of the risk factors for even cardiovascular diseases, right? Apart from this LPS, the compromised oral health could also inhibit the production of nitric oxide, which is required to inhibit triglyceride level, to reduce the triglyceride levels, right? So oral health is one of the key reasons why your children may be at the risk of having high TG level and even heart attack, right? Heart disease. So it is very important to fix oral health, to understand your oral microbiome, and understand what other factors apart from sugar, right, or ultra processed food is making leading to elevation of TG levels.